Well, hello.
Well, hello. Good to see you.
Good to see you as well. So this is our very first podcast. So this is going to be a lot of fun. Can we just start with some introductions? Who are you?
So I'm Bob Dannenhoffer. I'm the pediatrician in town here since 1989, and I'm the public health officer for Douglas County.
Great. Tell me a little bit about your training here.
So in my training, I went to medical school in Albany, New York, and then did my residency in Massachusetts at Mass General Hospital. And then I was in the Navy for 5 years, and then I came here to Roseburg.
It's a very exciting history. And how long have you been a pediatrician now?
So I started my pediatric training in 1980, so about 44 years ago.
Okay. That's one of the things I want to get to today is talk about kind of the differences you saw maybe, 30, 40 years ago compared to the kids that you're seeing today.
So the kids we see today are generally much healthier than they were back in the 80s. Infections far less common, asthma is under much better control, but we do see a lot of teens struggling with mental health issues, especially anxiety and depression. And I think the overall fitness of kids these days is lower than it was back 40 years ago.
Interesting. Do you have any ideas why that may be?
Well, I think the levels of anxiety are multifactorial, but I think some of the big factors are the influence of social media. So with social media, kids are very focused on their phones and social media, and when they are, negative things spread so rapidly, and teens are so sensitive to negative information about themselves. So I think social media is part of it. I think for the decline in fitness, we just see kids spend less time outdoors playing. And because of that, I think kids are heavier and less fit than they were 40 years ago.
Yeah. Interesting. Do you think there's good benefits to social media, though?
So I think there are some benefits. I think I certainly use some social media as a way to connect with people.
Right.
I'm getting ready for my 50th high school reunion, and I'm not sure in the time before social media how you'd have done this, but now I'm connecting with a bunch of people that I haven't seen in 50 years, and we'll go back for the reunion. And it's really exciting and great to see the great accomplishments of some of these kids who are just my high school locker mates and such.
Yeah. That's great. One thing I want to talk about a little bit as well is this question that I keep getting, and we'll kind of just launch into it. So the idea is from parents and from staff members at school, teachers, that kind of thing. They always ask me this question: is vaping safe, or is it safer than cigarettes? I have a hard time answering that question for a couple of reasons. But I kind of want to get your take on it and how you might approach that when you get asked that question.
Well, cigarettes, we know, are very unsafe, and they're unsafe for several reasons. The first is you're breathing in burning material, and those burning materials have microparticles that get into the lungs and cause irritation in the lungs and lead to COPD and to lung cancer.
Right.
Also, when you're breathing in carbon monoxide, and it's not good to be breathing in carbon monoxide. We know even low levels of carbon monoxide for a long period of time have detrimental effects. And then lastly, you're breathing in some nicotine, and nicotine is a very potent chemical and has some effects, some which people like, which is the relaxation they get from it, but some which are harmful, such as the vasoconstricting effects of nicotine. Now, with vaping, what you're doing is breathing in an aerosol. That aerosol contains multiple chemicals and some nicotine. Now, it doesn't have any burning material, so that's good. And it doesn't have carbon monoxide, and that's good. But it does have other chemicals which can be dangerous. You may remember a time back in the 2019 where we had a lot of people being injured from vaping-associated lung injury.
Right. Valley, yep.
Or Valley is what we used to call it. And that was from things that were added to vapes. Now, there's a lot of other things added to vapes too, and we do not know what the long-term effects are, so we do worry about that. And the concern with vapes is that kids who are vaping are getting far more nicotine than they ever got through smoking.
Right.
So it used to be kids would smoke and they'd smoke 1 or 2 cigarettes a day. We're now seeing kids using a full vape cartridge every day.
Right.
So they're getting dozens of times as much nicotine as kids ever got from smoking.
Yeah. When I approach this question, I kind of open the scope a little bit because the idea is vaping safer than cigarettes? Well, for whom, right? Are we talking about a 60-year-old who maybe has cancer and is trying to quit smoking? Or are we talking about, a 13-year-old who has never tried this before? And I think those are two very different answers.
Yeah, so safer always is a complicated question. Neither are safe.
Correct.
I think tobacco is dangerous in many ways. I think vaping is dangerous in other ways. So, when we do lots of things in life, and we try and compare safety, but neither are safe, and certainly not safe for kids.
Right.
Now, if adults want to use cigarettes or adults want to use vaping, that's one thing. But when I see 11 and 12-year-olds come in, I had this one 12-year-old who I'd seen was using several vape cartridges every day. And so was getting a tremendous amount of nicotine. And I don't think anybody knows what the long-term effects of that much nicotine at that young an age is.
Yeah, and there's really not much research on this, right? I mean, we think of vaping, but then there's also these new nicotine pouches, Zyn, Ono, other types of brands. And people ask me about this all the time, and I go, there's not a whole lot of data out there. We don't really know these long-term effects.
There really is not a lot of data out there. Now, again, smoking is dangerous, but it's not saying that these things, because they're less dangerous than tobacco, are safe to use.
Right.
So I think people would want to be really careful about that. Vaping is especially problematic. In the old days when kids would sneak a cigarette or two, they would frequently cough a lot, and they had a very negative experience the first and second and third time they smoked, and many just did that and never did it again, and then others went on to smoke. However, with vaping, especially the flavored vapes, there's really not that negative initial experience, and what we're concerned about is that kids will get hooked and hooked quickly. You see these kids walking around vaping in after school, and yes, there were kids who smoked before, but I'm not sure that this vaping is a safe thing, and certainly not anything we would encourage.
Right. I've seen a lot of the sort of the other side, these retailers talk about how it helps adults quit, how, it's beneficial in that way. But the data that I've seen really has shown a huge, tremendous growth in the number of young people who start this, who were not using cigarettes, who are not using any nicotine products, but now are. More so than the adults who use this to quit. And quitting is often kind of defined loosely, right? You quit this, but you're not really quitting nicotine at all. You're going from one substance to maybe a less harmful substance.
So theoretically, vapes could be a way to help people stop smoking. And smoking is so dangerous for so many reasons. I just a woman in the office yesterday with potential mouth cancer from smoking, and we think that you might use vaping as a bridge to stopping smoking, because many of the other ways we have people stop smoking is with nicotine replacement products, sure, either through patches or gums, and we think that in some people that is successful. So maybe in some people, vaping would be a bridge to help people quit. In reality, it's a rare occurrence.
Right.
In reality, vaping is a gateway to get people addicted to nicotine.
Right.
Again, really, if it was a cessation product, it would be there next to the nicotine gum. It would be there next to the nicotine patches.
Yeah.
It would be unflavored, or it would be in a plain white container. I think the fact that we're seeing a lot of these sales in convenience stores and gas stations, that we're seeing these flavors that appeal to young people, really suggest that the true market for vapes is to addict a whole new generation of people onto nicotine.
I've seen a lot of bigger tobacco companies start investing in vapes, smokeless tobacco, because the data that I'm seeing is we have less than 3% of kids who are smoking cigarettes anymore. I mean, the amount of smoking has gone way down when you talk about cigarettes, but now you look at vaping products, those kinds of things, they're really skyrocketing.
And I think the companies are not stupid. They understand what their market is, and they understand that tobacco smoking is going down, and so they're trying to replace their income stream with a whole new generation of addicted kids.
Yeah. You talked a little bit about the nicotine replacement therapy, or NRT. I kind of want to get your take on using it in the office. I've seen some things come out for providers who are using NRT in adolescents. Now, this isn't typically recommended. I don't think there's that many studies on it by any means, but they are using it to help kids to quit vaping. What are your takes on that?
So you can use nicotine replacement products to help kids get off vaping, but vaping is so culturally popular that it is really hard to get kids to stop. Now they could just slow down the amount of the vaping. I mean, that would work. Yet it's really hard to get kids to do that.
Yeah. The next thing I want to lead into is this idea about harm reduction and so I've heard from parents, I would rather buy this vape for my child than they go to school and risk getting this vape from some unknown source. The concern is maybe it's laced with fentanyl or some other drug, and there's a lot of popularity around fentanyl, and there's high risk with fentanyl use, right? I've even had family members. My sister, in fact, had that same dilemma of she found out her daughter was vaping, and now she's addicted to the stuff.
Well, this is a big dilemma. And one of the big dilemmas is that some vape products are adulterated, and they can be adulterated with fentanyl or with other drugs, which can be really quite dangerous. So that is a problem. But if you have a kid, especially a 12 or 13 or 14-year-old who's addicted to nicotine, really what we need to do is get them away from that addiction. Drugs on a growing brain are not a good thing, and that much nicotine for that long a time is really problematic. And think of what you just said. You know, a young child very addicted to nicotine already at that young age. That is really, to me, quite tragic.
Yeah. And on the flip side of that, what if I've actually had this occurrence too, where the parent says, well, they're not addicted now, they haven't used it, but they've expressed an interest in experimenting with vaping because it looks so cool or so fun, I want to try this thing. What do you say to parents who say, should I get this for my child? Should I let them try it so they're not trying it from unknown sources?
No, we shouldn't. Kids should not be using drugs or alcohol until they're adults and their brain is nearly fully formed, which for most kids is going to be 21. And that's why we have laws about restricting the use of these products until kids are older, because we really do not want to experiment on growing brains.
Yeah. I've talked with a lot of school nurses who have developed really good relationships with their students. And one of the things that they've been finding is that their students report having tougher time going upstairs, tougher time in athletics and sports, their shortness of breath, and they're using these vaping products. I haven't seen much data that supports that. This is very anecdotal data. Have you seen that in the office?
So we've not seen scientific data showing a decline in lung function for people who are either vaping or have secondhand vaping. And so this is still a young issue. I mean, how would you actually do this experiment? You're not going to get parents to donate their kids to go ahead and do scientific experiments at age 14. So we have not seen a lot of data on the effect of vaping on lung function. But this data would be hard to get, right? You have to do somebody who's been using it for a long time and compare them to other age-matched controls. It's not like you could do a randomized control study where you would have parents donate their kids to treat them with nicotine and see what it did to their lung function. Anecdotally, we do know that kids who are using nicotine are sometimes having trouble sleeping, that kids who are using nicotine are having troubles with appetite. And so overall, not a good thing to use. And we would just say to kids, just stay away from it. And if when you're later on you choose to use it, that would be a choice you can make later on. But really at 12, 13, and 14, kids need to be staying away from alcohol, drugs, marijuana, and tobacco.
Yeah. How do parents have that conversation with their child? I mean, if you're in the office and I worked together for quite a while, and we did something called anticipatory guidance, right? Can you tell me a little bit about what that is and what that looks like for providers?
So anticipatory guidance is talking about things that are likely to occur in the near future. So usually when kids are 10 or 11, I start talking with parents about anticipatory guidance for them being exposed to drugs and alcohol. And I usually start by saying, when you talk to adults who drink or smoke and you ask them when they first started, that's usually the answer you get is 11, 12, or 13, which seems remarkably early, but it's pretty consistent that adults who use started when they were very young, 11, 12, or 13. So when their 10-year-olds come in the office and say, I know this is not important for you today, but it's going to be very soon, because as kids at 11, 12, or 13 are exposed to classmates or other people at school who smoke or drink or use marijuana, that they could easily get exposed. So this is the time to have that discussion and talk about what the rules in your family are. Now, some families have remarkably liberal rules. like, oh, the kids want to use, that's fine as long as they don't hurt themselves. I think most families, even among people who use, is that they really want their kids to wait. And we know that people who start smoking or drinking later are much less likely to have troubles than kids who start early. So the anticipatory guidance really starts at 10 or 11 so that parents at least have that discussion. And I hope that what we do in the office is the entree to that discussion so they can have that bigger discussion at home.
Yeah. How has that guidance changed over the years from when you say started practicing 40 years ago to today? Has there been much change at all? Has it changed dramatically? What has been your take on that?
Well, what's changed is there was no vaping.
Yeah.
Marijuana was illegal in much lower use than it is today. So I think we talk a lot more about that, as well as the other big concern we have is kids sharing pills. Many of the pills we see around today are adulterated with fentanyl, and even a single pill can be deadly. Mm-hmm. And so we're also talking about not ever taking a pill from a friend. Hey, I got this from my mom's cabinet or whatever. Why don't you try it? So I think that's changed over the 40 years.
Yeah. And how long have you been practicing in Douglas County?
So I've been in Douglas County since 1989.
1989. And has there been any big differences from when you started practicing to today in terms of medical outcomes, the guidance that you give, how youth have developed over time?
Well, some things are really remarkably better. So when I started here in 1989, we still had a lot of disease called vaccine preventable disease by Hib and pneumococcus. We now have great vaccines against those, a great vaccine against rotavirus. So those three diseases, which made up a lot of our work back in the 80s and early 90s, are now gone.
Yeah.
I mean, I've not seen a case of chickenpox, rotavirus, Hib disease, or invasive pneumococcal disease in years because the vaccines are so great. And that's a good thing.
Yeah.
We are much better at treating diseases like asthma and croup. I mean, I can remember a time where there would always be a few kids in the hospital with asthma and croup. We almost never get anybody in the hospital now because there's such good treatments. Mm-hmm. So those things are much better. I think the mental health stuff is much more worrisome. We're seeing a lot of kids with anxiety and depression. We're seeing a lot of older teens with what we call failure to launch. So, I mean, I can remember at a time when I was a kid, you turned 15 and you wanted to drive right that day.
Yeah.
You wanted to date, you wanted to get a job. And I'm seeing a lot of kids who are 17, 18, 19 who are kind of aimless. Mm-hmm. They're not driving, they're not dating, many are not going to school. They don't really have a sense of the future. And I think that is a very worrisome thing when we look at teen mental health.
Yeah. Interesting. And again, you talked about that earlier. Like a lot of that is probably linked back to social media, and
I think social media is part of it. I think the pandemic had a very negative effect on young people. Mm-hmm. I mean, at my age, 2 or 3 year swath of my life is not a big deal.
Yeah.
When you're 18, a 2 or 3 year swath of your life is a lot.
Right.
And so many of the teens went through that. There was so much anxiety at the time. There's a lot of social isolation, and that caused an issue. I think the discord in American society, where people like to yell and scream at each other, really reflects back to kids. Mm-hmm. I mean, kids see the very negative stuff that's happening in politics, the January 6th stuff, and they see that, and they're just not sure how to react to that. And then I think the last part of it is that what we're seeing among many of the kids is more substance use. Mm-hmm. I had a kid who was in the office yesterday who was using 8 grams of THC a day.
Wow.
You know, the typical recreational dose is going to be 30, 50, 80, maybe 100. This kid was using 8,000 milligrams a day.
Oh, man.
And it's hard to imagine how you could function using that much marijuana. That was not something that we saw 10 years ago. And I think with the legalization of marijuana, people normalized marijuana, and then they said it must be safe now because it's legalized.
Right.
Well, it's maybe safer than getting drunk every day, but it's certainly not safe, and certainly not safe on an emerging brain.
Yeah.
And so put all those things together, the teens are really suffering, and I think we as a society really owe it to them to try and make their lives a little easier.
Yeah. I think when I was back in school, it was hard, right? Schools, I think, was always kind of difficult. But I think the kids today have it much harder than even I did 10 years ago. There's all these new things, new apps, new social media. So you're really onto something with that. That is a huge problem. It's multifactorial, and yeah, I'm not sure the right way to solve it. I try to fight back a little bit at the public health level with social media and promote positive messages, positive media, to let kids know that they do have it hard, but they're not alone and that there is help.
Right. And they do have help, and they have support from their parents. I mean, in the most part, parents don't really understand social media as well as the kids do. Mm-hmm. But we've had a couple of kids get into the sexting thing, where they're spreading nude photos, and then they get bullied or really badly hurt afterwards. We're seeing kids who are not sleeping, and you say, well, tell me about your sleep pattern. Well, I'm up texting friends, all through the night.
Yeah.
And that really interferes with sleep, which then also interferes with mental health. So all of these things go together.
Right.
But I think the overall milieu among adolescents is a bit much more worrisome than it was years ago.
Yeah. The last thing that I want to kind of wrap things up with is talking about cessation. And so in my role here, I try to develop really great cessation programs. I do my best to, right? And I do lots of research, figure out what's good, what's not good, what's scientific and evidence-based. One of the things that I learned was something through incentives, right? So we started the smoke-free pregnancy program here. And through my research, what I found was that in certain groups, using incentives along with a quit class can work really, really well. So one of those classes, one of those demographics is if you have a mom who's pregnant. That's a really high risk group, so that works well. If you have elderly who have emphysema or other lung conditions, they have a high motivation to quit those things. And so in those groups, incentives work very well. But in other groups, if you're adult, you're otherwise healthy, and you want to quit smoking, incentives didn't seem to make much of a difference in the outcomes. And I find that it's so hard to develop a really good program. If I can get a 15% quit rate in a class, for me, that's fantastic. But, the pessimistic side of me says, well, 85% of people didn't. What are your thoughts?
Yeah, so quitting is hard. If quitting was easy, we wouldn't be having this discussion today, right? So quitting is hard, and most people have multiple attempts until they are successful. And they need to find the right gathering of circumstances to help them quit. So motivation is really important. For many people, a big motivator is their first heart attack. Mm-hmm. Had a mom in the office yesterday, and she had a mouth cancer scare. That's a big motivation. Here she was at 34, thinking that she might die from this mouth cancer.
Yeah.
So I think medical motivations are there. I think other motivations that are important is when they have kids. Mm-hmm. So when parents are smoking and they have young kids, we talk about getting done with smoking before the kids remember that you were a smoker, so that they don't pick up your habits. I think moms who are pregnant, that's a big motivation. So I think you have to find the right motivation and recognize that even a 15% quit rate is pretty darn good.
Right.
I think the second thing that you have to recognize is that it is hard work. And so working with people on a regular basis, lots of positive reinforcement for quitting is important. I think monetary incentives have not been as successful because this is a tough addiction. Mm-hmm. There are some smoking cessation products which are really quite good. So you can use nicotine replacement either in the patches or the gum. I think the Wellbutrin or the bupropion for quitting is quite successful. The Chantix is quite successful. And for some people, one is more successful than the others. So when I work with residents and we talk about quitting, we say, well, give it a try. And if it works, great. If it doesn't work, we'll try again. And if you try enough and try enough times, most people will eventually quit. Mm-hmm. And that's going to be important. But equally important is not getting new people started.
Right.
Right. So my rule of when you're in a hole is stop digging. And we're in a bit of a hole with our tobacco use in this country. And unfortunately, I think we're digging quickly to create a whole new generation of nicotine addicted people.
Right. Yeah, that's one of the things I especially take away from this conversation is this idea that quitting is very difficult. It's not impossible, but it is difficult, and it's so much easier just to not start, right? And more cost effective. It's easy. You just don't go down that path, and you can be very successful.
And so that's going to be our success, is getting kids to delay starting, right? Because not very many people get addicted in their 20s. Right. So when you look at people who smoke and you say, when did you start? Very few say, well, I started when I was 23. There's the occasional person who maybe started in the military in their early 20s. But for the most part, most people started very early. So our goal really needs to be work on those kids in the 10 to 17 year range and get them not to start with substances, so that we're not in their 30s and 40s trying to get them off those substances.
Yeah. Great. So tell me about what's going on in sounds like you're teaching residents now.
Yes. So the Aviva has a great family medicine residency. They graduated our first group of residents last year, and we have 3 classes of 8 each, so 24 current residents from all over the world. And I'm teaching them today, and we're going to be talking about things that you'll only see in pediatrics. So pediatrics is a lot like adult medicine, but there are a couple of dozen things which are really peculiar to pediatrics, and we're going to go through those today.
That's really exciting. Is that an enjoyment of yours, is teaching the residents?
It's a great enjoyment. So one of my great enjoyments is working with residents and teaching them about the joys of pediatrics. We had our last patient of the day yesterday was a little 16-month-old who was just absolutely adorable, and she was the epitome of what a 16-month-old would do. So she was learning how to walk backwards. She was doing this squatting thing where they squat to the ground and get about almost to the ground. She was learning how to do knuckles. And so she's doing that and do high fives. And she was just so adorably cute in doing that. And that kind of thing to show the residents that the development of kids is so amazing to watch and so predictable. Mm-hmm. And so predictable so that when they get to be teens, they want to try new things. They're experimental and they want to try new stuff. I think we just have to get them away from trying stuff which is potentially dangerous to stuff which is more healthful, like a sport or a new hobby or acting or something that they can do, which is going to be positive rather than some of these addictive substances, which can be really quite negative.
Yeah. That's awesome. Well, I really appreciate you being on the podcast. I want to end on one last question for you. What is your favorite thing about being a pediatrician?
So the favorite thing is watching the kids grow. And so I've taken care of many of the kids in Roseburg, and many of them now grown, and I watch them. They're going to medical school, and they're in dental school, and they're doing all these wonderful things. And that to me is as an example that I must have done something right. And certainly I had a tiny part in many of these kids, but certainly their parents have had. So as a parent, this is what you want to see. You certainly enjoy the kids as they're growing up, but then it's that sense when they finally grow up and do well that, oof, I didn't ruin them too bad. And certainly as a pediatrician, when I see them doing so well, I realize we've done okay.
Well, thank you so much for being on here. When can we expect you got a new book coming out? You're going to write a book or something?
No new one. I just have one in the past. So.
Okay. Well, thank you so much, Dr. Dannenhoffer, and maybe we'll be on here in the future.
I would love that.
Great. Thanks.
All right. Bye-bye.